Hello, I'm Dr. Louise Freeman of the Department of Psychology at Mary Baldwin College, here for part 2 of the video series as we count down to the premiere of Mockingjay Part 2. Now, I don't think it will surprise anyone that treating Peeta's hijacking will be a major part of the last half of Mockingjay. I will be talking about some of the treatments Peeta gets in the book, so there may be some minor spoilers for the movie. However, I will not be giving away any major plot twists. So, with that warning, let's plunge in. Welcome back to part 2 of my series of Psychology in Mockingjay videos. Today we're going to investigate psychology in Pan Am, what Peeta teaches us about PTSD treatment. So, to start with, first a brief recap of what we went over in the first video. Reminder, hijacking, as was done to Peeta, is a form of fear conditioning. It was very similar to the famous experiment by John Watson and Rosalie Rayner back in 1920, where they conditioned little Albert to fear a white rat by presenting it alongside a loud noise that scared him. After a few such pairings, little Albert began to be afraid of the lab rat, even though he had previously enjoyed playing with it. And this is very similar to what happened to Peeta. When the Capitol showed Peeta videos of Katniss and then injected him with tracker venom, the frightening hallucinations that the venom caused became associated with Katniss. And Peeta became so afraid of her that he would attack and try to kill her. Now, fear conditioning is part of the underlying pathology of post-traumatic stress disorder, or PTSD. So Peeta developed what I call a mutatin version of PTSD with exaggerated symptoms. I want to specifically focus on the first two on this list. Distress hyperreactivity to stimuli might be typical, but Peeta, his reactivity has become these completely uncontrollable urges to kill. And, typical PTSD symptom might be memory lapses about an event, but Peeta has completely false memories that he cannot distinguish from real. So, the question everybody, especially Katniss, has at the end of the last Mockingjay movie: what do we do about this? Is there any way to cure him? Well, to start off, I think we need to consider what the mental health care system is like in District 13. I guess you could say the good news is that they do have one, even if they don't call it that. As the book tells us, District 13 has what they call head doctors, who seem to recognize that there are conditions that need treating. Anyone who they think is mentally ill, and that includes Katniss, Finnick, eventually Joanna, gets a bracelet reading mentally disordered and gets treatment of some sort. However, you do not hear terms like psychology, psychiatrist, post-traumatic stress disorder, so they probably do not have a lot of specific terms for those conditions or formal diagnostic criteria. But the people in District 13 do come up with some treatments, and very interestingly, all of them bear some resemblance to the way PTSD is treated in our world. So, first one, counter-conditioning. Prim is actually the one who comes up with this one. It's very similar to the technique used by one of John Watson's students back in the 1920s. Cognitive approaches. People in Katniss's and Peeta's squad 451, almost by accident wind up using a couple of techniques from modern cognitive psychology, such as prolonged exposure therapy and cognitive restructuring therapy. We'll see more about those in a minute. And finally, we'll see some use of art therapy, at least in the book. Whether that will turn up in the movie remains to be seen. So, first, counter-conditioning. In 1924, Mary Cover Jones, who was another student of John Watson's, published about a case that was kind of like Little Albert in reverse. She brought a little boy named Peter into her lab. Peter had a lot of fears, was particularly afraid of animals. Specifically, he was afraid of rabbits. Now, unlike Little Albert, as far as we know, Peter had not been deliberately conditioned to fear rabbits. He had simply acquired this fear in some unknown way, just like little kids do. So, the first thing Jones did was to let Peter watch other children play with rabbits, so he could see an example, see their example, and see that they could play with the rabbit without getting hurt. But then what she did is she put him in a high chair and gave him his favorite snack, which of course made him happy. We like our favorite foods. They are an unconditioned stimulus for the emotional response of happiness. Then she brought in the rabbit, initially in a cage. Later, she'd eventually use the rabbit outside of the cage and would gradually, over a period of time, over days, in fact, would bring it closer and closer to his high chair while keeping Peter calm and happy with his snack. So, over time, after repeated pairings of the rabbit with the snack, his fear of the rabbit decreased until he was eventually comfortable letting the rabbit actually sit on his lap and nibble his fingers. So the fear that had been associated with the rabbit has been eliminated and replaced with positive emotions. Peter is no longer afraid of the rabbit. So Jones called this condition counter conditioning, and it remains a very popular way of treating phobias and other fear disorders even today. In fact, it's been said that all behavioral therapies trace their origin back to this landmark study of the 1920s. So, quite remarkably, given that she is 13 years old with no formal training in psychology, Prim actually manages to reinvent this very same approach. In the Mockingjay book, we are told that she has an idea to, quote, hijack Peeta back. So here is her plan. Peeta is hijacked. He is afraid of Katniss. But Prim wants to expose him to Katniss or to a video of Katniss, and then give him an injection of morphine, Panem's very powerful narcotic drug. This drug is a unconditioned stimulus for calmness, relaxation, tranquility. So Prim's hope was that if they did this enough, Katniss herself will become a conditioned stimulus for calmness instead of fear and homicidal rages. Now, unfortunately, Prim's idea did not work. The morphine turned out to give him enough morphine to calm him down, also knocked Peeta out. And apparently you do have to be conscious in order to make learned associations. But given her age and lack of training, I think, have to give her credit for independently recreating a classical treatment protocol. Now, if District 13 had had a reference library and Jones' paper had been available for Prim to consult as a resource, she might have thought to try something else, maybe lamb stew or bakery cake or tasty bread, some of Peeta's favorite foods instead of a narcotic drug like Jones did with little Peter. Unfortunately, I think we have to assume that all the libraries were destroyed in the war, and she did not have access to Jones' research. But we'll have to give her an A for effort, given that she tried. All right, the second example, prolonged exposure therapy. This technique involves teaching relaxation therapy, or relaxation techniques, to the patient. and then intentionally exposing them to whatever it is they are afraid of. And it is based on the idea of extinction. So you get them to relax, you train them how to relax, and then you might initially start out having them just imagine or remember or visualize whatever it is that normally triggers the panic attacks or the conditioned fear response. Eventually, hopefully you would be able to move on to real life or in vivo exposure to it. If you do that enough, the fear should extinguish. Now, I know we learned at the last video that PTSD patients have a particular problem with extinction. It takes a long time, but it should happen eventually. Now, what happens in Mockingjay? Well, Peeta has to spend time with Katniss. Initially in District 13. They try to get him to go and have dinner with her at the cafeteria, to be around her in situations where he can stay calm. I don't think I'm spoiling anything here, but eventually they are going to get sent on a mission together. They're put into the same squad, Squad 451, on their mission to invade the Capitol. And this is a picture from the trailer, so we can see that they've been placed on the team together. So you would predict that this long-term togetherness on this mission should help reverse the hijacking through extinction, through prolonged exposure, if, and this is of course the big if they can keep Peeta calm during this process. So next, cognitive restructuring. This is a technique where a therapist works with a PTSD patient to identify and correct false memories and beliefs associated with the trauma. So remember, sometimes people with PTSD have trouble remembering exactly what happens during the initial trauma, and as a result, they can develop some misconceptions. They can false memories, false beliefs. This Peeta, of course, again, just doesn't have memory lapses. He has a complete set of false memories. For instance, remembering Katniss killing his family, Katniss destroying District 12. And he cannot tell these false memories from his true memories. Here's an example of something he says in the book. To Katniss: friend, lover, victor, enemy, fiance, target, mutt, neighbor, hunter, tribute, ally. I'll add this to the list of words I use to try to figure you out. The problem is I can't tell what's real anymore and what's made up. Now Jackson, who is part of their squad, winds up inventing a game that they call Real or Not Real, that they play during their downtime. And this is what they do is Peeta recounts one of his memories and someone tells him whether it is real or not real. And what's good about this is that Peeta does eventually learn how to tell them apart. He describes the false memories as shiny, too intense, or unstable. So picks up on cues that tell them, no, this is not a true memory. So this also is a nice example of something that helps Peeta that has a parallel in a modern-day PTSD treatment. Now, both exposure therapy and cognitive restructuring have proved very successful in treating PTSD. For example, here is a 2010 study by Thrasher et al., where they had PTSD patients and they were randomly assigned to receive either exposure therapy, cognitive restructuring therapy, or both. And both therapies actually helped reduce symptoms. They worked particularly well together, and they worked best in people who had a strong social support network or social support system, family, friends, to support them through this process. So The fact that a lot of these interventions are happening in the context of the squad, the team, which includes a lot of people who have become very good friends, was probably very important in Peeta's recovery. We also know that the amygdala, up here in red, the small almond-shaped structure that's found deep within the brain, is very important in fear processing. If you put PTSD patients into a brain scanner, you will find they have elevated activity in the amygdala. So in this study by Flemingham et al., they did 8 weeks of exposure therapy and cognitive restructuring therapy in combination with patients. And they found this after the 8 weeks of treatment, not only were behavioral symptoms reduced, but so was the amygdala activity. So it caused a improvement not only in behavioral outcomes, but also in this physiological process within the brain. So another therapy frequently used in trauma patients, particularly in children and teens, and although we sometimes forget, Katniss, Peeta, a lot of these characters are still teenagers throughout the Hunger Games, is art therapy. So here is a study that was done in 2007 with child survivors of the Asian tsunami of 2004. And these kids were placed in a special art therapy treatment program. So one day, for instance, they were asked to draw a picture of a day I will never forget. And what many children drew was the tsunami. On another day, they were asked to draw a picture called Safe Places and Memories. Many of the kids actually drew pictures of family and friends who had died in the tsunami. So the conclusion by the researchers was that this art therapy helped the children, quote, regain emotional control that was shattered with the tsunami and to commemorate their loss. So these children who had been through, of course, this very, very horrible disaster seemed to benefit from art therapy. Now, we haven't seen a huge amount of this in the movies, with one exception, when Peeta paints the picture of Rue for the judges in Catching Fire. But for those of you who have read the Hunger Games books, you know that art is a very powerful healing force in the book series as well. Peeta. Of course, we already knew Peeta was a master of camouflage and an expert cake decorator, but he takes up painting for his talent after the 74th game. And like the Asian tsunami kids, most of his pictures depicted the trauma. So he is painting pictures from the arena to comfort himself. In fact, he says to Katniss, it's better to wake up with a paintbrush in my hand than a knife. Remember, the Haymitch is the one who sleeps with the knife. So at this point, again, the art seems to be helping Peeta cope better than either Haymitch or Katniss with the trauma associated with the games. Also in Catching Fire, Katniss and Peeta get out the Everdeen family plant book and update it with Peeta drawing and painting pictures, Katniss writing up the text on the properties of the plants, what you use them for, everything like that. This, of course, is a very important book in the Hunger Games. It is the one that Katniss used to find edible plants that kept the family from starving. It's also the one her mother uses for medicinal plants in her healing practice. So getting it out, updating it, Katniss calls this quiet, absorbing work that helps take my mind off my troubles. And Peeta says this is the first time we've ever done anything normal together. So again, and this really is, not just a report. These types of books are true works of art with beautiful pictures, paintings, that sort of stuff in them. Finally, in Mockingjay, as we will see, Katniss will eventually start a memory book to honor the loved ones she has lost. And her head doctor agrees that this is actually good for her, gives her the paper for it. She is able to find comfort in these memories, and eventually both Peeta and Haymitch are going to contribute to this book as well. So once again, we see art as a very powerful force of healing. So, at the end of the day, what can we learn from Peeta's treatment in the Hunger Games series? Well, the first thing I think we see is a literary illustration or a literary example of several modern-day therapies for post-traumatic stress disorder and other fear disorders. For instance, Prim independently developing Jones's counter-conditioning procedure. We see prolonged exposure therapy, cognitive restructuring, and art therapy. Second, we see a reasonably realistic version of the difficulty and the challenges in treating PTSD. Haymitch tells Katniss, Peeta will never be the same. And I think it becomes obvious that he is never fully the same. Post-traumatic stress disorder is a long and difficult thing to treat. Not everyone can be fully cured, but the good news is treatments are available, and most people can get considerable help from the right treatment. So this, I think, is the value in understanding it, to not only help us understand what's going on with the characters, but help us understand what's going on with the people around us who have post-traumatic stress disorder, either from combat, from accidents, from attacks, from whatever trauma that they've experienced, to elevate our knowledge of the condition, hopefully to elevate our compassion for people who suffer from this disorder. So, for our next video, we are going to go into the world of neuroscience and look at the feasibility of hijacking and whether that type of very sinister memory manipulation is possible today. We will actually examine some very recent cutting-edge research by neuroscientists that suggests that, at least in mice, some forms of memory manipulation and some actual forms of memory rewriting may be possible. So, if you're interested in the brain, interested in brain science, please tune in, because I think you'll find these memory experiments very interesting and very relevant to the whole issue of hijacking. So that is the end of video 2. If you would like more discussion of topics like this, again, here are your choices. Check out the next video. Is hijacking possible? Visit hogwartsprofessor.com. Remind you, for more Hunger Games Trilogy scholarship, you can check out this book that is coming out next May, Critical Insights on the Hunger Games by Salem Press. It includes an extended version of these talks, plus the work of many other scholars on many other topics. I also will be making some more videos on psychology and popular young adult series. If you want alerts on when new videos come out or just want to ask questions, please send an email to divergentinDepth@gmail.com. I am particularly interested in hearing from fans of the series who are studying or teaching psychology, as well as anyone using Hunger Games in the classroom. So, divergentinDepth@gmail.com. This is my own email list, and I will not pass it on. So, see you next time.
So, thanks again, and I hope you'll come back for video 3. I'm Louise Freeman from Mary Baldwin College, and once again, may the odds be ever in your favor.